I'm Dr. Gary Estadt, chiropractic physician with Lake Health. I'm here today to talk to you about lower back pain. Lower back pain is the #1 cause of disability worldwide. In fact, 60 to 80% of the population at some point in their life will suffer from debilitating lower back pain. And up to a third of the population suffers back pain every year. It's the second most common reason for medical office visits, second only to the common cold. And it's the most common cause of disability for those under the age of 45 years old. So back pain is a very serious condition, but most people consider back pain a plain and ordinary disease. Why? Because it's not a life-threatening disease like cancer or heart disease. But it is the leading reason for medical office visits and hospitalizations. It's the leading reason for restricted physical activity. And it is also the leading reason for both the use of prescription and non-prescription drugs. So it is a very serious problem. Although 1/3 of people who suffer from lower back pain usually recover within a month to 3 months, over 2/3 of people who suffer from lower back pain still have it after a year, and many of them never recover. Hundreds of billions of dollars are spent every year in the treatment of back pain, and much of that money is spent on diagnostic testing and treatment. Lower back pain is also the leading reason for the use of opioid medication. In fact, 2/3 of all use of opioid medication is used in the treatment of spinal pain. And we know what an opioid crisis we're having in Ohio today as a result of treatment of back pain with opioids. As far as the causes of lower back pain, the most common cause of lower back pain is what we call nonspecific lower back pain. Those would be your sprain or strain injuries, slip and fall injuries, or somebody who just wakes up one morning and they have back pain for no apparent cause. Other less frequent causes for back pain are spinal arthritis, disc injuries and sciatica, and a condition called spinal stenosis, which people often get as they get older. Infections, spinal fractures, and spinal tumors account for less than 1% of all back pain. So when a patient comes in to a physician or a chiropractic physician's office complaining of lower back pain, how do we determine what they have and how we should treat them? The first way is we have to do a proper history and a proper physical examination on the patient. The physical examination and the history are going to help you lead to the type of pain that the patient is suffering from. And from the history and the physical exam, we can determine what additional tests, if any, are necessary. Somebody who has nonspecific lower back pain may or may not require x-rays. Somebody who has things like nerve pain, serious pathology, might require imaging like spinal x-rays and additional diagnostic tests like nerve conduction studies or laboratory testing. And then those with serious pathologies like persistent lower back pain, radiculopathy or nerve pain, or spinal stenosis might require MRI. Treatment options for lower back pain vary. We know that opioids and narcotic medication have historically been used in the treatment of lower back pain, but they've contributed to the overall opioid crisis that we now suffer from around the country and in Ohio. The state of Ohio, under the governor's opioid task force, has developed guidelines for the management of both acute and chronic pain that recommend non-pharmacological treatments as well as non-opioid drug treatments in the treatment of spinal pain. The current medical research also supports these treatment recommendations, and it is the treatments that are performed in most of the leading hospitals around the United States. These treatment options include, number one, self-care options for the patient. We have to teach the patient that their condition, while painful, is not life-threatening, and we need to teach them how to deal with their pain. One of the things we try to get them to do is an early return to physical activity. Now, a patient may require short-term bed rest, but bed rest over 1 to 2 days is actually detrimental for spinal problems. So we try to get the patient active early. We try to teach them when and how to exercise to help relieve their lower back pain. And then we give them lifestyle options like diet, exercise, how to rest properly, proper way to get in and out of a chair to help them assist with treatment of their own back pain. Diet is very important in that many of us eat foods that are pro-inflammatory, which contributes to the overall pain crisis that the patient's having. So we try to teach the patient and educate them on having a more healthy, anti-inflammatory diet. Next would be medications with proven benefits. In the treatment of back pain, those would include NSAIDs like Advil, Aleve, ibuprofen, and possibly aspirin. Also, you could use acetaminophen like Tylenol in the treatment of back pain. For the non-pharmacological or non-drug treatment options for back pain, the number one recommended treatment is spinal manipulation. Spinal manipulation has been found to be effective in both the treatment of acute back pain as well as chronic back pain. Additional non-drug treatment options would be physical therapy, acupuncture, spinal decompression therapy, or medical massage. If conservative treatment measures fail to improve your pain or increase your functional outcomes, then other more aggressive treatment options may need to be considered. These would include things like pain management injections, surgical options. Lake Health chiropractic physicians work as part of your overall healthcare team to assess your back pain and determine what are the best treatment options for you.